All right, thanks everybody for joining us here today. Today I'm actually welcoming back John Samuels, the founder and CEO of Better Health Advisors. We had John on a TouchCare talk a couple months ago, telling us about his business and the importance of creating a health plan for anybody who is thinking about their long-term health and strategy around health and health finances and important things like that. As a reminder, John has spent the last 20 years of his career as a senior healthcare leader at a variety of different top hospitals and emergency rooms here in New York City. He's a public health savant. He spent his entire career working in public health and in emergency rooms. So he has a great amount of perspective that I think is really interesting for, and as it relates to what's going on in sort of the global health situation that we're currently in here today. So John, thanks for joining us and thanks for coming on. Anything else that I missed that you want to add?
Thanks, Rob. I appreciate the opportunity to sit down and chat a little bit.
Absolutely. So as I mentioned, John, you've got a really unique perspective as someone who's built a really long lasting career in public health, and you've run some of the busiest emergency rooms here in the most densely populated part of America, New York City. Talk to us, if you will, just a little bit about what's going on in emergency rooms across the country and for that matter, really across the world right now, because the news and the news cycle that we all sort of consume on a daily basis paints a pretty bleak picture. And obviously that's at least partially true. But I just thought, your perspective would be really, really interesting on that.
Appreciate it. So we're seeing different parts of the countries have different amount of influx of patients into the emergency rooms. So fortunately in New York, which was the epicenter and probably still is in many ways, New York is seeing less patients surging the ERs, but certainly other pockets of the country are seeing that. And there are many vulnerable populations who are being affected right now by the pandemic.
Yeah, and so speak to that a little bit more. I mean, it's sort of obvious that the healthcare system and our hospitals itself are really, really overstretched during this time, and we weren't, as a country, prepared to handle the gravity of what we've been hit with. What else should we be concerned with in terms of like our most vulnerable populations?
Well, first of all, for the hospitals and the ERs, the greatest threat to them is their staff and making sure staff are able to care for patients and are healthy. So that's why PPE, protective patient equipment, is so important and vital for our hospital, for our staff and so forth. So really critical for them to be healthy so they can care for the population. And for those who are most vulnerable, like we certainly know that those who have chronic illness are vulnerable. We're very worried about patients in nursing homes. Nursing homes are densely populated, even more so than the general population. And by definition of being in the nursing home, they're sick. So we're very concerned about nursing homes and what's happening, what's happening there, and the pandemic.
And if somebody, something we've spoken about in the past, John, and if somebody in a nursing home or somebody who is in your home that you live with gets infected or tests positive, what's the protocol from there? What are the best practices that somebody should put into place if they know somebody in their home or a loved one in a nursing home that they think might be infected or that is infected?
Yeah, I think the first step to that is prior to somebody being infected or being worried that they're infected, is having a plan. And I think if we have plans in facilities, nursing homes, as well as our home, to go through the steps to identify who's most at risk. And if we do think somebody has the virus, then making sure that they're isolated and monitored effectively. I think we need to use our medical team, primary care doctors, infectious disease experts, and so forth, to help steer and manage the care. One of the things that we're certainly seeing, not just those who are in sort of the subset of high risk, we're certainly seeing obesity as a factor in individuals who are getting COVID-19, and to that end, we're also seeing men getting it more than women, and a cohort of younger men, 30 to 50 aged, coming into the hospital with COVID. But fortunately, often those folks are surviving. But certainly getting the virus a lot, and I think the information is unclear as to why that's happening. But public health experts around the country are certainly looking closely at that.
Yeah, it's an interesting scenario, and I think it's a great point that you bring up, that the best thing that we can do as individuals is start to develop, or at least think about and create, maybe put pen to paper to an actual plan, right? What do you do if you start to have these symptoms, and where are the closest places of care, and you know, who's my emergency contact, and things like that, little things that you maybe aren't thinking about. You're sort of used to doing that in an emergency room where you come from, right? Where you've sort of got to model and walk through so you're prepared for anything that comes your way. But this is kind of something that hit us all by surprise to some degree, in terms of like, we haven't seen something like this, at least in recent history, that's challenged emergency rooms in this way. So it's interesting, and I think the consumer role in this is, you know, having a plan can also help have a positive impact on the system itself, right?
Yeah, I mean, right. Well, so the greatest thing we can do right now, and you know, my company, Better Health Advisors, has been working hard to support the emergency departments, and sometimes that's like giving food, or
Yeah.
you know, doing recognizing different individuals there who are heroes. But really, in addition, it's one thing we can really do is to stay home, and that's following guidelines. And you know, as far as planning is concerned, it's you know, we have a parallel pandemic right now. Not only do we have this virus, we also have a pandemic of anxiety.
Yeah,
And many of us believe that we had it prior to this epidemic, and it's really certainly exacerbated now. And to that extent, if one has a plan and knows what they're going to do, if they have symptoms, as we said, what hospital are they going to? What are they bringing with them? If somebody gets it, how will they behave? What will they do? All those things. Once we have a plan, often it alleviates some of that anxiety, and anything that alleviates anxiety right now in a positive way is a really good thing for people.
totally. So in that light, right, there is some room for positivity, and especially here in New York City, you know, monitoring the 24-hour news cycle as many of us are, it's been a little encouraging lately to see that the curve seems to be flattening, or at least trending in the right direction. The hope, of course, is that we're sort of at least slowly on the road to recovery, and hopefully beating this thing. Um, what are some of the bright spots that have come out of this whole scenario, and what should give us hope right now?
Yeah, I think that some of the public-private relationships, and relying on the academic medical centers, the Johns Hopkins of the world, helping steer has really been a really positive thing. I think the role of telemedicine and using that more has certainly been positive in this. And as I said, if this brings to light our anxiety pandemic, I hope that people will continue to recognize their anxiety as and like any other disorder of the body, and talk openly about it and get treatment for that. And lastly, you mentioned New York City. In New York, every night at 7 o'clock, as most people see, people are clapping for first responders. And to me, it's nothing new. It's not new to see first responders and emergency medicine and EMT and other folks who are out there. It's nothing new for me to see them as heroes. I've seen it on the day after Thanksgiving in a busy day, or a short staff day, or just a surge to an ER. But it's certainly wonderful to see the recognition people get, and that I'm hoping that continues, because it's a beautiful thing to see.
Yeah, absolutely, and I couldn't agree with you more. And even just from a business standpoint, on the TouchCare side, we've seen a ton of increase in the utilization of our virtual care tools, both at the telemedicine level and the teletherapy level, because people are looking for solutions and ways to get care without leaving their homes, and it's become really, really important. And I hope you're right. I hope it sort of shines a light on the importance of kind of investing in those things moving forward at the employer level and at the health care and health insurance level. Um,
And Rob, to that point, we've had, we know we have a really big problem in our country about access to care. There are
yeah,
rural areas around the country where access to top care is really very, very difficult. And even there are some specialties that fit in really well and just sort of move forward quickly with things like telemedicine, like psychiatry and psychology, and and sort of if we can begin to recognize and fill those gaps. And there were changes to reimbursement on that immediately, which
yes,
help, right? Those kind of things help, and companies like yours help because it increases awareness and access, and provides a resource for individuals where access to care has long-standing been a big problem.
yeah, absolutely. So what, lastly, I guess to wrap this up, as we do continue to, hopefully trend in this right direction, and as employers specifically start to think about getting back to work, what should they be thinking about, right? How should they be thinking about putting the right processes in place so that their employees are safe and the workplace is safe when they do start to think about reopening their doors and bringing folks back into their office or their place of business, et cetera?
Yeah, so we've been contacted by a lot of employers and small companies, and I think that it's overwhelming for a HR department or a chief operating officer to think, okay, now what? How do we do this, and how do we do it safely? Because of the
Yeah,
factors you mentioned, and the complexities, and how the stakes, because the stakes are high. I think about an employee who has a child who has chronic illness, and they're worried about telling their boss that, or going back to work, and how to do that safely. So
totally.
in situations like this, I think other comparable situations, we rely on experts. I think we use experts to help guide and plan and assess and organize and put a strategy in place so that we're able to manage these kinds of things. So I think the best advice I would have for them is to utilize an outside expert to consult with and to get really good specific and custom advice to support them and support their employees.
That's great. Um, John, really appreciate your time and your perspective. I think it's truly needed for individuals, for employers at this time as we sort of try to navigate what all of this means to all of us, and how we get back to work, and keep doing the awesome work that you guys are doing with your clients. Really appreciate it.
Thank you for the time, and TouchCare has really been wonderful for lots and lots of patients and companies. So thank you for you guys what you're doing.
Yeah. All right.